John, what's your question for the candidates?
I am indeed. Well, since I was diagnosed with cancer and I've had the operation and that, I was promised loads and loads of care and whatever else. I've had to rely on a company called Help Harry, Help Others. It's a cancer-based charity. I had no help at all from Macmillan or my cancer nurses. Why is the NHS broken? And that's a question to Mr Sunak and Mrs Truss.
Rishi Sunak, to you first.
Well, John, I'm really sorry to hear about that, and I'm glad that you're at least now getting the support that you need. I grew up in an NHS family,
I'm not
John.
Mr Sunak.
Sorry, I can't hear you, but you mentioned a company that was helping you. Is that right?
It's a cancer-based charity, Help Harry, Help Others, and without them, I don't know what I would have done.
Right. No, well, I'm glad they're able to provide some support to you. No, look, I grew up in an NHS family. My mum was a local chemist, my dad was a GP, so I know firsthand what an enormous difference healthcare makes. And the reason the NHS is under strain at the moment is because it's recovering from COVID. And we all know that. And we saw what happened during coronavirus for the NHS. We saw the pressure it was put under, and we also saw what was happening in social care. And there are many people like you who are waiting to get the treatment that they need and deserve, particularly with regard to cancer. And that's why I did something really difficult, that I'm actually getting a lot of flack for at the moment, and I'm sure we'll talk about it tonight. And I made sure that we got the NHS the funding that it needed to help work through the backlogs, get everyone the care that they needed, and do that as quickly as possible. Now, it wasn't an easy thing for me to do, and as I said, I've got a lot of criticism for it. But I believe it was the right thing to do, because I don't think we can have an NHS, which is ultimately the country's #1 public service priority, that is underfunded and not able to deliver the care that it needs. And that's why I think you can be reassured that the NHS is safe in my hands, because I've taken what was a brave decision to get it the support that it needed. And I hope that that is reassurance to you in the future that we'll continue to support the NHS so it helps people like you and millions of others get the treatment that they need.
Liz Truss, John's question essentially was that he struggled to get NHS support and GP appointments.
Well, first of all, can I just say to John, I'm incredibly sorry to hear about his experience in the NHS. And in fact, my mum worked as a nurse at St James's Hospital in Leeds, specialising in cancer research. And I know a lot of work goes into that area, but we need to do more. And there has been issues during COVID about people being able to get the support that they need. I think the issue is that too often we are directing and micromanaging people on the front line, the doctors and nurses who do the work. And what I want to see is fewer layers of management in the National Health Service and less central direction, because I simply don't think that people can sit there in Whitehall and direct everything that happens in local communities across our country. And I would like to see more support based in GP surgery, so fewer people have to end up in hospital. Also focusing on things like ambulance waiting times, which are a real issue as well, particularly in rural areas. And this is all about giving more power locally and making sure that we trust the professionals who really know what they're doing. But I really wish you all the best for your recovery, John.
So we're going to come back to some of the detail and the economics on this in a minute. But John, you are still with us. Do you feel that that answered your question?
I do and I don't, because the Conservatives have had the chance already, and it's still not enough for the NHS.
I mean, it's a good point that John makes there, isn't it, Rishi Sunak? You were the Chancellor, you know the numbers. You yourself have said that NHS funding is unsustainable. We're spending more than ever before, and yet ambulances are queuing up outside NHS hospitals. Level with us. If the answer's not money, then what is it?
Well, the answer has got to be that we need to do things differently. And we need to do things differently so that people get better treatment quicker. And there's lots of different ways that we can do that. And technology is a large part of the answer, whether that's new blood screening techniques that will detect cancers earlier, which we're now trialling, which I think is something that's incredibly exciting. It will mean we can help people get the treatment they need sooner and ultimately survive. But also using new forms of surgical hubs. To get through this backlog of elective surgery, we can create specialised hubs where surgeons can work really productively to crack through the backlog. I'd like to see more of those. Community diagnostic centres are another innovation that we need to do more of, where you bring together CT scanners and other diagnostic devices in one place, in a one-stop shop, and the doctors all organise around that, and it moves people through the system far quicker. And again, what I've said is I'd like to see more of those. So I think if we use all these different new innovations, which is part of my plan to tackle the backlogs, and that's what this NHS and social care levy that I've put in place, which lots of people now say that they want to scrap, that's what it's funding.
But that's barely covering the cost right now, and you're talking about innovation.
It's funding those community diagnostic centres, it's funding those elective surgical hubs, it's funding the new technology that helps physicians focus on what they need to do, which is treating us, rather than bureaucracy and other things. Now, so if we do all those things, and there's a plan that I've published that says that from day one, tackling this backlog will be my #1 public service priority, I'm confident that we can get the wait list down quicker. People like John will get the treatment that they need quicker. But we're not going to be able to do any of that if the NHS doesn't have the security of the funding it needs. And that's something, as Chancellor, that I put in place.
Point there. Liz Truss, you have said that you want to scrap the national insurance increase. So where will extra money come from for the NHS?
So I am committed to the extra money that was announced for the NHS. It is needed to deal with the backlog. And I would fund that money out of general taxation. Under my plans, we will still be able to start paying the debt down within 3 years. So it is affordable. And the fact is, whatever Rishi says now, we did not need to raise national insurance in order to pay. We did have that money available in the budget. It was a choice to break our manifesto commitment and raise national insurance. I think it was the wrong choice to make. I spoke out against it at the time in Cabinet. I still remain opposed to it, and I will reverse that rise. But on the subject of the National Health Service, I'm committed to the 40 new hospitals that we have agreed to build. I'm afraid some of our hospitals are falling apart. The Queen Elizabeth Hospital in King's Lynn near me, bits of the hospital being held up by stilts. That is not good enough for patients across the NHS. But as well as more money, and we do need to put more money into the physical fabric, we also need to trust the people in the NHS. And sometimes, to me, there are lots and lots of grand plans and reorganisations, but what it comes down to is allowing doctors and nurses who know what they're doing the freedom to deliver on the front line.